As you know, February is Heart Health Month, and it's a time where we are really trying to encourage people to focus on their heart health. And did you know, according to the World Health Organization, cardiovascular diseases are the leading cause of death globally, men and women, taking an estimated 17.9 million lives every single year. So we've been trying to focus on heart health all throughout the month of February. And joining us back on the show this morning with Hartford Healthcare is Dr. Anja Wagner, who is with the Heart and Vascular Institute at St. Vincent's Medical Center. And welcome back to the show, Dr. Wagner. I love having you here. How are you?
Good morning. Thank you for having me.
I'm so glad to have you back. First of all, heart disease, as we mentioned, number one killer for both men and women. However, there are significant differences when it comes to symptoms for a heart attack, depending on the gender. Let's talk about this. Let's start with women first. What are some common heart attack symptoms for women, and then what are the symptoms for men?
Yes, so both men and women may suffer from what we call more typical symptoms of a heart attack that everybody seems to know, like chest pain, chest pressure that can radiate to the shoulders, arms, neck, or jaw. And these symptoms tend to worsen with exertion. However, many women also present with what we call more atypical symptoms. So these are rather subtle symptoms. They're really less obvious, like shortness of breath or nausea, indigestion, fatigue, or just not feeling well.
Why is that? Why do women go through those symptoms?
Nobody really knows why that is, but the problem with that is that many women think or blame these symptoms on other things, like having a sleepless night or weight gain, or just not having exercise or having eaten the wrong food. And so the diagnosis can be often missed and treatment delayed.
Well, that's just it. I was going to say all the symptoms you just said, Dr. Wagner, those are, pretty common. Nausea, indigestion. If it were me, I would just pop some Pepto-Bismol and I'd move on with my day, right? I'm just saying, like, those are pretty common kind of whatever sort of symptoms.
Yes. And so what is also a problem is that many women are really not aware first that cardiovascular disease is the number one killer. So there was just a recent study that has shown that only 44% of all women are aware that cardiovascular disease is their number one killer. And only a minority really is aware of the symptoms of a heart attack. Like that we said, it can be just shortness of breath, indigestion, fatigue, or just nausea.
Wow.
And so that really often leads to the point that women don't seek any medical attention or the diagnosis is delayed.
So do women tend to ignore the signs more than men?
Yes. And that's because these symptoms are more atypical. And also again, there's overall, traditionally, there's a misconception that heart disease is a men's disease.
That is interesting, though. Again, we have Dr. Wagner here with Hartford Healthcare, because you're right. I think society-wise, we always think with heart disease, we think of the classic guy goes out for a run, I should say, and then collapses in the middle of their run. Person is at the gym and collapses at the weight station. It's interesting that we have put that depiction in our mind as a society. Why do you think that is?
I don't think anybody knows, and it's really interesting. The American Heart Initiation or American Heart Association had this initiation Go Red, which probably everybody knows. And they have done a great job. Just imagine, in 1997, only 7% of women are aware that heart attack is their number one killer. And then in 2003, it was only 13%, and we got it up to 44%. But there's just a lot more work to do.
Wow. So I'm curious, Dr. Wagner, are the treatments the same for men and women?
In theory, yes. So, but again, studies have shown that a woman with the same risk factors or symptoms is only a third less likely to receive the same diagnostic testing and treatment. So a woman after a heart attack is less likely to receive the guideline-directed medical therapy like statins or undergo procedures to restore the blood flow to the heart, like stent placement or bypass surgery.
Why are they less likely?
Sometimes, sometimes the woman is just a little older than a man. In theory, women have heart disease 10 years later than their male counterpart.
Oh, interesting.
And so they're a little bit more frail in general. So there is a slightly higher risk of bleeding when they undergo a heart catheterization to restore the blood flow or bypass surgery. But that may be one explanation, but it's unclear to me.
Interesting. And as far as knowing the signs, okay, so we can keep an eye out for the symptoms, but are there tests or things we could do to check our heart health today, Dr. Wagner?
Yes, absolutely. So it really depends on the patient. If the patient has any symptoms that are clearly indicative for heart disease, then and they have acute symptoms like chest pain, then heart catheterization, it could be performed. That's something we basically inject dye in the coronary arteries and see if there's a blockage. But then there are also screening tests for somebody who has a lot of risk factors, like a stress test, a treadmill exercise stress tests, for example. And then if somebody has a lot of risk factors, but really absolutely no symptoms, for example, a bad family history, then there's something called a calcium score, which is a really quick test, just 5 minutes, and we can see how much calcification is around the vessels of the heart. So this is an excellent screening test, and also helps us really to prevent the disease before it becomes symptomatic.
Yeah. Now, is that something that you have to ask your primary care physician for, or is it like when you hit a certain age, you should get that test done?
Yeah, in general, it really, again, it depends on your risk factors. In general, we think that somebody who's in their 50s should have a stress test. But then if you have significant risk factors like a family history of heart disease, that means you had a mother that, for example, died before the age of 65 from a heart attack or had a heart attack before the age of 55, or a father who had a heart attack before the age of 55, then we kind of recommend earlier screening. Mm-hmm. And other risk factors like diabetes or sedentary lifestyle or smoking, these things may prompt us to check you earlier. But in general, it's always a good idea to just get screened if you have risk factors and to discuss the risk factors and how to modify the risk factors with your primary care physician. And then if he feels indicated, he will refer you to a cardiologist.
And again, if you want to learn more, you certainly can go online to hartfordhealthcare.org/heart. And I want to thank you again, Dr. Anja Wagner, for coming on and sharing all this information with us. We really appreciate it.
Thank you for having me.
You're very welcome. Again, Dr. Wagner with Hartford Healthcare, a cardiologist with the Heart and Vascular Institute right here at St. Vincent's Medical Center on WICC.